Hello, hello. Good evening, everyone. Good evening. Hello. My name is Phyllis, and today we will be assisting with rehabilitation after a stroke. That's what we will be talking about today. Welcome, welcome, welcome. You can forward that question on our website to Nurse Eunice. Welcome, welcome, welcome. About the tutoring. All right, I'm going to give it a few more seconds before we actually get started. You're welcome, man. All right, let's go ahead and let's get started. Happy Friday, everybody. Happy Friday. Happy Friday, everybody. All right, let's talk about a stroke. What is a stroke? A stroke happens when blood flow to a part of the brain is interrupted either by a blockage or bleeding. The cut this cuts off oxygen, nutrients, causing brain cells to die. Another name for a stroke is cerebral vascular accident or CVA. This term refers to the sudden loss of brain function due to a disturbance in the blood supply to the brain. Cerebral relates to the brain and vascular relates to the blood vessels, highlighting the involvement of the brain's blood flow in this condition. All right. Let's see. All right. Immediate medical attention as they can lead to brain damage, disability, or death. Common signs and symptoms of a stroke can be remembered using the acronym FAST. FAST drooping is one side of the face numb or drooping. Arm weakness is one arm weak or numb. Speech difficulty is the person's speech slurred or hard to understand. T, time to call 911. If someone shows any of these symptoms, seek emergency help immediately. Early treatment can significantly improve recovery and reduce the risk of long-term complications. Right. Moving right along. If you're just not joining today, we are talking about rehabilitation after a stroke. Okay. I'm sorry, you guys. Hold on. All right. Does a stroke affect the body? A stroke can affect different parts of the body depending on where the brain is damaged. Movement. A stroke can cause weakness or paralysis on one side of the body. All right, congratulations on passing your test. All right, we're moving right along. Speech and language. A stroke may a stroke may lead to difficulties in speaking, understanding, and writing. Sensation. Some people experience numbness or loss of feeling on one side. If you're just not joining, today we're talking about stroke, rehabilitation after the stroke. Vision. There could also be problems like blurred vision or losing part of the visual field. Thinking and emotions. Stroke can also affect thinking, memory, mood, and behavior. Recovery varies for each person and depends on the extent and location of the brain damage. Rehabilitation helps in regaining lost abilities. Careers, careers that provide rehabilitation and post-stroke care. Home health aide, certified nursing assistant, restorative nursing, physical therapist, occupational therapist, and speech therapist. The importance of physical and rehabilitation therapy. Therapy helps patients regain strength, balance, mobility, independence, and quality of life. Speech therapy. Speech therapy sessions help to improve communication skills after a stroke. Assisted device. For safety, encourage the use of any recommended assistive device, example, walkers or canes, to aid mobility and independence. Assistive devices are prescribed by the physical therapist, example, cane, walker, wheelchair, overhead trapeze. Daily exercise. Encourage regular practice of exercises ordered in the patient's plan of care to maintain and improve motor skills. Also allow patients to participate and help in their own care. All right, emotional support. Be patient and understanding as emotional well-being is crucial. Stroke survivors may experience frustration, anxiety, or depressions during recovery. Can families support the patients? Family members can help by being patient, assisting when needed, encouraging rehabilitation, and advocating for the patient. Nutrition. Nutrition. Encourage patients to eat a balanced diet rich in foods, vegetables, lean proteins, and whole grains to aid recovery and overall health. Home care safety measures ensure the environment is safe and accessible with necessary modifications if required. Example, grab bars in the bathroom. All right. Practice KISS, caring for stroke patients. I'm going to give you guys a few seconds to see if any more is going to be added on. I'm going to show me. Hi, you guys. Hi, hi, hi. All right. First question. Where should the call bell be placed for a patient who has had a stroke affecting the right side of the body? Is it A, on the right side, B, at the foot of the bed, C, on the left side, D, anywhere within reach? Drop those answers in the chat, you guys. Either A, B, C, or D. Okay. All right, let's go ahead and reveal the answer and see what it is. If you chose C, you are absolutely correct on the left side. The call bell should be placed on the unaffected side, which is the left side, so the patient can easily assess it. Stroke patients often have weakness or paralysis on one side, and ensuring the call bell is placed within their reach is essential for safety and independence. If you chose C, way to go. Number 2, a patient who has a stroke is showing signs of a decreased level of consciousness. What is the best course of action for the CNA to take? Is it A, turn the patient on their side, B, inform the nurse immediately, C, offer the patient food to improve energy, D, wait and reassess the patient in 15 minutes? Let's see. Drop those answers in the chat, guys. Either A, B, C, or D. A few more seconds to see if anybody's going to drop any answers in the chat. If you don't know it, if you do know it, just give it a try. All right, let's go ahead and see what the answer is. If you chose B, you are absolutely correct. Inform the nurse immediately. A change in the patient's level of consciousness can indicate worsening neurological status. The nurse must be informed immediately to assess the situation and provide necessary interventions. All right. 3. When caring for a stroke patient with difficulty swallowing, which of the following should the CNA do during mealtime? Is it A, encourage the patient to drink large sips of water? B, position the patient in a semi-Fowler's position? C, ensure the patient is in an upright position? D, feed the patient quickly to avoid tiring them. Drop those answers in the chat. A, B, or C. What do you guys think? A, B, or C. What do you guys think? All right. If you chose answer C, you are absolutely correct. Way to go, you guys. Ensure the patient is in an upright position. Patients with difficulty swallowing should be positioned in an upright position during meals to reduce the risk of aspiration. Proper positioning helps the patient swallow more safely. All right. Next question. What is the best way for a CNA to assist a stroke patient with one-sided weakness to get out of bed? Is it A, encourage the patient to get up on their own? B, support the patient from their strong side? C, use a transfer board without assistance? D, leave the patient in bed all day and wait for the physical therapy team to perform the tests. What do you guys think? A, B, or C, or D? All right, I got some B's coming in. All right, let's go ahead and see what the answer is. If you chose B, you are absolutely correct. Way to go. So you're going to want to support the patient from their strong side. When assisting a stroke patient with one-sided weakness, it's safer to support them from their strong side to avoid overexertion or loss of balance on their weaker side. Way to go, you guys. A CNA notices a stroke patient's facial drooping has worsened. What should the CNA do first? A. Ask the patient to smile. B. Elevate the head of the bed. C. Inform the nurse immediately. D. Help the patient drink water. What do you guys think it is? A, B, C, or D? All right, let's go ahead and see what the answer is. Oh, wait, I still have some more answers. Okay, let's go ahead and see what the answer is. If you chose C, way to go. Inform the nurse immediately. Worsening facial drooping could indicate another stroke or worsening condition, and the nurse must be notified immediately to assess and take appropriate action. Way to go, guys. Okay. A stroke patient becomes frustrated while trying to speak. How should the CNA respond? Is it A, encourage the patient to continue speaking without assistance? B, finish the patient's sentence for them? C, offer patience and give the patient time to express themselves? D, avoid eye contact to prevent further frustration? What do we have? Is it A, B, C, or D? Tell me your answer in the chat. Tell me your answer in the chat, or what do you think it is? A, B, C, or D? Okay, I got a lot of C's coming in. All right. Let's go ahead and reveal and see what the answer is. If you chose C, you are absolutely correct. Offer patience and give the patient time to express themselves. Stroke patients may experience difficulty with speech. The CNA should remain patient, giving the patient time to communicate without interrupting or finishing their sentences. All right. 7. A stroke patient with left-sided weakness is at risk of pressure ulcers. How can the CNA help prevent skin breakdown? A, turn and reposition the patient every 4 hours. B, apply lotion to the patient's affected side. C, place a heating pad on the affected side. D, turn and reposition the patient every 2 hours. Drop your answer in the chat. Is it A, B, C, or D? Okay, I got a lot of D's coming in. Okay, D. All right. And I'm going to reveal the answer. If you chose D, you are absolutely correct. You want to turn and reposition the patient every 2 hours. To prevent pressure ulcers, stroke patients who have limited mobility should be turned and repositioned every 2 hours to relieve pressure on the skin. Way to go, guys. Way to go. All right. How can a CNA help a stroke patient improve mobility in their affected arm? A, encourage the patient to use the affected arm for a simple task. B, avoid moving the affected arm to prevent injury. C, immobilize the arm with a sling. D, only move the arm during physical therapy sessions. What do you think it is? A, B, C, or D? Drop those answers in the chat. Drop those answers in the chat for me. A, B, C, or D? Okay. All right, let's go ahead and reveal the answer. If you chose A, you are absolutely correct. Way to go, you guys. You want to encourage the patient to use the affected arm for simple tasks. Encourage the patient to use the affected arm for simple tasks helps improve mobility and promotes rehabilitation. Always follow the care plan and therapy guidelines to prevent injury. All right. Give me a thumbs up if you're already a CNA or want to become a CNA. All right, next question. A family member of a stroke patient is frustrated because they feel the patient is not improving fast enough. What is the best response from the CNA? A, it can be frustrating, but recovery takes time. Let's talk to the nurse about the care plan. B, maybe the patient is not trying hard enough. C, I don't know why progress is slow. You should ask the doctor. D, you're right. The patient should be doing more by now. Drop your answer in the chat. A, B, C, or D. All right, Ms. Catherine. Well, good luck to you on your skills state exam Tuesday. Good luck, good luck, good luck. Wish you the best of luck. All right, let's go ahead and reveal the answer. If you chose A, you are absolutely correct. It can be frustrating, but recovery does take time. So let's talk to the nurse about the care plan. So, offering empathy and explaining that recovery after a stroke can take time is important. Referring the family member to the nurse for further discussion helps to address their concerns appropriately. Way to go, you guys. All right. A stroke patient insists they can't walk to the bathroom on their own. Even though their care plan indicates they need assistance, what should the CNA do? A, let the patient attempt to walk on their own to encourage independency. B, insist the patient stays in bed and call for the nurse. C, explain the need for assistance and offer to help them safely to the bathroom. D, allow the patient to use a wheelchair instead of walking. What do you guys think it is? A, B, C, or D? A couple more seconds for you guys to drop the answer. What do you think it is in the chat? A, B, C, or D? All right, let's go ahead and reveal the answer. If you chose C, you are absolutely correct. Explain the need for assistance and offer to help them safely to the bathroom. Stroke patients may overestimate their abilities and can be at risk of falls. It's important to explain the need for assistance while promoting safety and offering help ensures they remain safe while maintaining dignity. All right. Bonus question. Let's see. A family member is upset because they believe the patient should be doing more physical therapy. What should the CNA do? A, tell the family member to speak directly with the physical therapist. B, reassure them that the patient is receiving the appropriate amount of therapy and suggest involving them in therapy sessions. C, agree that the patient needs more therapy. D, ignore the family member's concern as it is not your responsibility. A, B, or C. Let's drop them in the chat. Drop that letter in the chat. A, B, C, or D? All right, we're going to go ahead and reveal the answer. If you chose B, you are absolutely correct. Reassure them that the patient is receiving the appropriate amount of therapy and suggest involving them in therapy sessions. Reassuring the family and suggesting they participate in therapy sessions can help them better understand the patient's progress. The CNA should not make decisions about therapy, but can provide support and offer helpful suggestions. Way to go, you guys. All right, great job, team. Once again, please like, share, and subscribe at www.floridatraining.com. Does anybody have any suggestions or anything else they would like to learn? Do I have any CNAs out here today? Give me a thumbs up if you are a CNA or wanting to become a CNA. Give me a thumbs up. You're welcome, Miss Chrissy. You are welcome, welcome, welcome. Welcome, welcome, welcome. Any CNAs out there? No CNAs out there? All right. Any suggestions on what the next topic that you would like to know more about? Please drop it in the comments. I will give you time. Please drop it in the comment, in the chat. Okay, that's good. Well, at Florida Training, you can always go. There's good tools and stuff out there. There's always live sessions. You just have to like, share, subscribe, and you can keep up with all of that. Okay, CNA. So if you want to become a CNA, is there anything that you have in mind that you would like to know before you become a CNA? Drop it in the chat and we can see what we could get going for you guys on the next slides. All right. Well, all right, you guys. Well, once again, my name is Phyllis. You guys did a great job this evening. You guys have a wonderful and safe weekend. Don't forget to like, share, and subscribe at www.floridatraining.com. Until next time, I'll see you guys later. Have a safe weekend.